How's it going? My name is James, a student physical therapist here at Avon Health University.
My name is Johnny, also a student physical therapist at Avon Health University.
And today we're going to go over pulse oximetry. With pulse oximetry, there's many things to consider. And today, our presentation is going to go over some measurements, assessments, and how to apply these findings into a clinical setting when dealing with patients.
Before we get to the nitty-gritty, let's talk about what exactly is pulse oximetry.
All right, anyway, so pulse oximetry, what exactly is it? So pulse oximetry is a device used to measure the oxygen level, or also known as the oxygen saturation of the blood. And it is a device that is easy and a painless measurement of how well oxygen is being sent to parts of your body away from the heart, such as the arms and the lungs. And how it works is the device uses a light to measure how much oxygen is within the blood. And then when taking measurements from the device, it all will be recorded underneath the SpO2 label. And then the numbers based off of those, anything between 95 to 100% is within normal range. And then anything less than 90% may require some supplemental oxygen via oxygen tank, and may also be some clinical considerations when planning an accord for treatment. When it comes to assessment and interpretation of respiration, it is important to know what we're looking for. So respiration is the measurement of the individual's intake of oxygen and exhalation of carbon dioxide per minute. And normal range is going to be between 12 to 20 breaths per minute for adults. It's important to not let the patient know that you're measuring their breathing, only because they will be providing inaccurate numbers. So it's important to, for example, take their radial pulse, and then in reality, you're checking their breathing just to provide accurate numbers. And factors that may affect the individual's respiration rate includes age, exercise, body position, environment, and emotions.
When taking a person's pulse oximetry, there's many factors to consider and things to look out for. For instance, sources of patient-related error are not limited to, but include nail polish, cold extremities, or even excessive motion. All these factors can alter or skew the final reading or measurement that is seen on the pulse oximeter. Another factor to consider is darker skin pigmentation, specifically when blood oxygen saturation levels are low. So if this reading is below the 95 to 100 threshold that is normal for blood oxygen levels in saturation, this can be due to darker skin pigmentation. Also, altitude level of location is a very important factor. Higher altitudes will result in lower arterial oxygenation. So, for instance, if a patient is having their measurement taken in Denver as opposed to Miami, the one in Denver is normally going to be lower because of its relation to the sea level. It's going to be a lot higher than Miami. In turn, it's going to have a lower reading. Also, hypercapnia, which is an excess of CO2 within the bloodstream present in patients. This will show lower oximetry readings, but O2 supplementation cannot be administered. A lot of times, if this O2 reading is a little bit lower or below that 95 to 100 threshold, a lot of times supplementation of O2 is needed. However, this will do the opposite effect. Even though it's a low reading, when this is administered to a patient, if they do have hypercapnia, it will in turn further lower that and increase the CO2 within the bloodstream. All these factors combined, along with nail disease and anemia, can all alter pulse oximeter readings. Lastly, these are the resources we use for our findings for this presentation. Now, from the presentation, now that we know the ins and outs, the findings and reasonings behind a pulse oximetry reading, we can use to apply it in a clinical setting. So here, as we are in the clinic with our patient Johnny over here, we're going to go ahead and take his pulse oximetry reading. So this right here is called a pulse oximeter that we have talked about. To turn it on, there is a button right here for the power, which will turn it on and display a screen with the O2 saturation levels in the top left corner and the BPM for the pulse rate in the top right corner. And right here in the middle of the screen is where the numbers are going to be displayed. Now the next step is to put it on correctly. So what we're going to do is we're going to turn it back on, clench the back of it, pinch it just like this, almost like a gator's mouth, and we're going to put it on to the index finger. Johnny, may I see your left hand?
Sure can.
Gonna go ahead, we're gonna put it on just like this. Good body mechanics. Put this on just like that and let it rest and see what the reading is gonna be.
So now that we've got the reading, So on the right side, that'll show the beats per minute for the patient, but we're gonna be looking more on the left side. Right above is gonna be the percentage SpO2. That is the number we're gonna be looking for. So this right now we got a reading of 99%, and that is within normal range. So anything between 95 and above is the numbers you're looking for. Those are perfect numbers. Anything below 95, that'll be some significant clinical considerations and may need some additional testing to determine what is causing the lower numbers.
Well, after the presentation and demonstration that we did today, I hope that you all learned something about pulse oximetry and the importance of the measurements and findings of the result. Any last words, Johnny? Well said, my friend. Have a great day, y'all.